Very good evening, dear doctors. This is Dr. Aishwarya on this end, and I will be hosting the session for today. So, before starting off the session, I would like to give up a brief introduction about the Pratnya forum that we are in. So, it's basically a platform that's created by young Ayurveda doctors to establish a kind of connect with veterans in the field of Ayurveda. So we are also involved in doing the campaigns, welfare programs, and also medicine manufacturing and production. So thank you all for joining this. And so today we have a veteran joining us with us. So we have Dr. Dinesh sir joining us to talk about cerebral palsy. So who doesn't know Dinesh sir? I mean, like we all know Dinesh sir, and he's got a lot of credentials to attach with. So he's currently serving as the professor HOD of Department of Kaumara Bhratya at PS Warrior Ayurveda College, Vaidyaratnam Ayurveda College, Kottakkal. And he's got a lot of feathers to adorn his hat, but I would like this opportunity to mention two important autism institutes that he is actually heading. It is the Ayukam Ayurveda Center for Autism and Learning Disability Management, and CIMCD, which is the Center for Integrated Management of Children with Differential Abilities. So I take this opportunity to welcome Dinesh sir wholeheartedly. Thank you, sir, for joining us this session, and we look forward to amazing learning experience from you. And at the same time, I would like to follow. I would want my participants to follow basic online etiquettes. It would be great if all of the participants can put your microphones on mute, and all the questions and interactions would be entertained in the chat box. And after the session, we will be having an interactive session where you can discuss your doubts and connect with the speaker here. Dinesh sir, it is a privilege to have you here. Please kick off the sessions.
Good evening. Good evening, Pratnya team, and thank you for this nice choice. Today, I will deal with cerebral palsy. Cerebral palsy, all of you know the case. Cerebral palsy is so common among the Ayurveda practitioners, and cerebral palsy is not increasing as the year advances, not in the same case of similar to the autism or ADHD. All those cases are actually increasing in number as the time advances. Cerebral palsy is not like that. Even from its invention, the time of invention, it is similar to static encephalopathy. It is similar in static in nature in its incidence and prevalence. In one Grama Panchayat, certainly there will be 30 to 40 cerebral palsy in Kerala. So, for one Ayurveda doctor, 3 Grama Panchayat is more than sufficient to make his livelihood, at the same time to give good therapies to such children. And the therapies what we are giving, if it is merged with the concurrent or current physiotherapy and other therapies, no doubt, I'm not giving the data, and because the data are always boring to common practitioners. It is only for the academicians. It is good. The combined effect of Ayurveda and physiotherapy and sensory integration therapy is triple or 4 times effective than the common management of physiotherapy in case of cerebral palsy management. So once if you are doing the proper management of Ayurveda along with other therapies from your premises itself, no doubt, not a single parent will leave your clinic in their lifelong period. It doesn't mean that we should confine them for lifelong, but it is needed. What I want to say, Ayurveda people are having the real trust area. Several trust areas are there, of which the most important one is cerebral palsy. Its other name is Little's disease. Leave it. I am sticking to the most practical side of the cerebral palsy, not into the theoretical discussions or anything like that. But we need some theories that I will say. How will you diagnose a case of cerebral palsy? That is very important. The diagnosis of cerebral palsy is a hectic process, but leave it. I am giving you one or two tips, because most of the people nowadays, even the Ayurveda degree holders, they are calling me, Dinesh sir, okay, I have a case of autism. Okay, I want to refer it to you. Okay, so I will tell them, I will give you the protocol for the management. You manage it. I will supervise you. But nobody is confident. Whenever the case comes in front of me, that will not be a case of autism at all. So everyone having a notion that if it is a congenital anomaly, that will be cerebral palsy or autism. There is no other cases. This is the scenario nowadays. Very pathetic. I am myself is responsible for that, because being a part of academician, I am also responsible for that. But still, we have to change it. Remember, I am considering all of you, because right now 59 candidates are here in this webinar. As the introductory speaker told, most of them are youngsters. I don't know how many of you are elders, and how many of you are practitioners. Highly practitioners will be there. Such people, you just forgive me. I am teaching. I am not doing the webinar. I am going to teach them some tips. Then only they will carry all these points in their brain to their clinic. That's why. So the elders may feel that why this fellow is coming to teach us like LKG student or something like that. But I am trying to teach something. Encephalopathy. Pathy means disease. Allopathy, against a disease. Homeopathy, similar to disease. Encephalo, total brain. Pathy, total brain is involved in this disease. It is static. Static means cerebral palsy will not give you a history of increased disease as the age advances. Whatever may be the condition previously, probably the same condition may persist. Cerebral palsy, even without a treatment, many cerebral palsy will improve. Even without a treatment, it may improve. So it is a static cerebral palsy. It is static encephalopathy. It means that it will not increase as the age advances. So before diagnosing a case, a cerebral palsy, you just ask, what was the condition 1 year before? 1 year before, same. Now also same. Okay, that is static. Sometimes you may see many other pathies in which 1 year back he had walking. Now it is not there. Or 1 year back he was having more skills than today. It means that it is not a case of cerebral palsy. So cerebral palsy is a congenital disorder, no doubt. By birth it will be happened. But it will be static, same, or maximum, the child will get improvement even without management. Previously, neck holding was not there. Nowadays, he used to have some neck holding. Okay, that is cerebral palsy. If any disease which is progressive in nature, as the age advances, the disease progresses, it means that it is not at all a cerebral palsy case. It may be something other than that. 1.5 to 2.5 cerebral palsy will be there in every 1,000 birth. It is also static. The rate is also static. This is the reason why, because I am telling around 30 cases will be there in 1 Grama Panchayat of Kerala population density. Right? This is its definition, of which 3 words has to be taken into your brain. Number 1, it is non-progressive. Number 2, it is motor impairment. It is motor. Motor means activities related impairment, or tone related impairment, or bulk related impairment. Okay. It should happen in the early stages of its development. Cerebral palsy will not start in 5th year or 6th year or 2nd year of life. It should happen at the time of birth, or the before birth, or immediately after birth. It will not happen at the age of 1 year. Up to the age of 1 year, he was perfectly all right. And after that, cerebral palsy started. No, nothing will happen. So 3 points has to be taken from the definition. Hope I am clear, Aishwarya. I am calling
Yes,
you
yes,
only why?
yes.
Because I want to interact. Otherwise, I don't know whether you are receiving it or not.
Sure,
Aishwarya
sure, sure, sure.
and one Sunita K is there in front of my screen. That's why. Everybody is asking what will be the cause of this cerebral palsy. Nowadays, my answer is that's none of your business now. Because whatever may be the cause, the treatment will not change, outcome will not change. There is no other thing. If you are going for another kid, okay, let us screen. If you are going for another kid, let us screen for the causes. If at all any genetic causes are there, let us treat. Genetics means we can treat. Don't think that by hearing the genetics, it is it is Yapia or Asadya. No, nothing at all. It is very well treatable, except the Mendelian inheritance. There are 2 types of inheritance, non-Mendelian and Mendelian. Mendelian inheritance means X-linked recessive, means certainly there will be carrier in females, no doubt. But it is not like that. The cerebral palsy or any other non-Mendelian inheritance cases are also there. Even with a single thought, the gene will change. If you are envious about your friend, he is gaining so much money, then even then also, your 20% of the genes are liable to get damaged. So don't be envious, be happy, stay happy, and embrace everyone. Okay. So those are the recent research works which are happening nowadays in epigenetics. Data Satyaparaha Chamavan Aptobasevi Na Bhavatya Roga. That is the reason why, because Acharya clearly told, be a giver, be truthful, be Chamavan, you will be healthy. Otherwise, you are prone to develop several autoimmune diseases. So don't frustrate yourself, because you will get autoimmune disease after 30 years. Okay. So there are several causes, prenatal causes, natal causes, postnatal causes, so many. But a commonality you can see that at the time of birth, there are deficiency of oxygen. At the time of birth, there are deficiency of oxygen. And that oxygen deficiency led to some, what we can say, anoxia in the brain. In the brain, there are several areas in which there are end roads. End roads means end arteries, arteries which are not having any connectivity with another arteries. So what will happen? Once anoxia happens, the distal end of end arteries will be totally devoid of oxygen. That area will be damaged. That type of damage. All of you know, the thing is that nowadays our cesarean section is coming to 40%, especially in Kerala. WHO is saying that if this creature is a human being, LSCS will not come beyond 25%. So are we not human beings? But still, here it is coming around 40%. Moreover, you might have seen the gulab jam. It is soft, or otherwise the rasgulla, soft spongy structure dipped in sugar syrup, isn't it? Similar is the condition with the fetal lung. Similar is the condition with the fetal lung. The baby has to come through the vaginal passage. This small vaginal passage has to transmit a baby who is having 3.5 kg weight and 50 centimeter length. 5 ml capacity uterus is holding near about 3.5 kg weight of this baby, half kg of placenta, 50 centimeter umbilical cord, 1.5 liter amniotic fluid. Such a wonderful organ. Nobody knows how it is happening. Science doesn't know why it is happening. And the baby has to come through the vaginal passage, and during this time, the total area of the baby will be squeezed. This squeezing will remove the fluid from the lung. The sugar syrup will be removed and the spongy rasgulla will be so softened so that air will come in. That is not happening in LSCS. So the more LSCS, the more chances of anoxia. In Malayalam, there is a poet, Kunyuni Mashi, you may be, how many Malayali, I don't know in this. There is a famous poet, and his 2 lines are there. Pandaka per, ippodaka kiru. So nowadays, the C-section is increasing. That is also a cause for the anoxia. And there are several other reasons. I am not going into all those details. But one thing is sure, the basic principle is there are deficiency of oxygen happening at the time of birth. And that is giving deficiency of oxygen is giving anoxia in the brain that gives rise to cerebral palsy. And there are some other causes in which Rakta-pradoshna vigaras are seen. All those are, number one is kernicterus. Kernicterus means bilirubin encephalopathy. Increase in bilirubin occurs during the first 5 days of birth. Beyond a certain level, this unconjugated bilirubin, bachelor bilirubin, the bilirubin who have never married with albumin complex, that is bachelor bilirubin, highly dangerous, highly toxic. Conjugated bilirubin, that is married bilirubin, harmless. Unconjugated bilirubin, very toxic. Beyond a certain level, it will cross the blood-brain barrier. It will be deposited in the red nucleus. It will be deposited in the basal ganglia so as to give cerebral palsy, which is called as bilirubin encephalopathy. Pythiga origin, trauma, infection, vascular reason, metabolic disturbances. Leave it. Simple pathology is that either diffuse cortical scattered focal atrophy. Don't be confused or don't get irritated with the Latin words. Those are very simple. We can have the nirukti of Latin so that we will get good pathology. Diffuse means spreaded. Cortical in cortex. scattered. Focal, in small area. Atrophy. Atrophy means not growth is happened. No growth is happened. Okay. Cystic softening. Round, softened area in the brain. Hypoplasia, not underdeveloped hypoplasia of the midbrain and cerebellum. And normal, sometimes in MRI, normal gross appearance with loss of cortical neuronal cells in microscopy. That means in MRI, everything will be normal. It means that, it doesn't mean that it is not cerebral palsy. No, there are neuronal loss, but they are highly minute and microscopic. Clinical features. There are 3 types: chorioathetoid, atonic, and spastic. And there may be a mixed type. That is the 4th one. Simple. I will make it simple. The presentation may be 3 types. Either there will be tight child. If you are holding the hand, if you are holding the leg, the total legs and everything will be so tight. That is spastic. Second one, flabby. There will not be any tone. Just like cloth, it will be too soft and there will not be any tone at all. That is atonic cerebral palsy. Third one is, there is cerebral palsy, but it is having some sort of movement. Always the baby is moving. So movement disorder, tight child, then loose child. The 4th one is mixed cerebral palsy. A mixing of all these symptoms can be seen. So these are the types of cerebral palsy. Simple. According to the regions affected, it may be 4 limbs affected, that is quadriplegia. One side, one hand and leg, hemiplegia. Similarly, the nomenclature is given if it is 2 legs, diplegia, if it is 1 limb, that is monoplegia, like that. So don't think that by coining a word, spastic quadriplegia, what does it mean? There are tightness along with 4 limbs are affected. Simply. Okay. Sometimes in your MRI, you can see big words, periventricular leukomalacia. Wow. Simple one. You take the nirukti. Peri. Peri means outside. Ventricular. Outside the ventricle. Leukorrhea means white discharge. Leuco means white. Leukoderma, white derma. Okay. So leuco. Outside the ventricle, leuco. What is leuco in the brain? That is white matter. Malacia. Malacia means loss of cells. Osteomalacia, loss of bone cells. Leukomalacia, white matter loss. Periventricular white matter loss. That is the simple name which is given to this terminology. Periventricular leukomalacia. Simply we call it as PVL. Then this is another multicystic encephalomalacia. Multi, more than one. Cystic, round. Encephalo, total brain malacia, degeneration. Total brain degeneration which is cystic in nature. That's all. See, how will you identify different clinical features which are associated to this? That is very important. In spastic cerebral palsy, the child will be highly irritable. Usually you may see the child is in the universal flexion position, you know. After 3 months, it will come down. After 4 months, it will again come down. You cannot see a child of 1 year of age in universal flexion position normally. But this flexion position is, if it is persisting, even in the 1 year of age, 2 year of age, it means that their neurological age is less than 3 months. Similarly, if you are making a sound, immediately the child will turn to a reflex like Moro reflex, that is called as startle. Similarly, several, if you are putting the finger inside the mouth of the baby, there will be sucking. That should vanish after some time. But if it is persisting again, it means that their neurological age is very, very, very less than 6 months. Babinski, usually it should vanish by 2 years of age. But if it is again persisting in the 5th year of age, it means that their neurological age is less than 2 years. All these are the features of spastic cerebral palsy. And these are the extrapyramidal cerebral palsy features, that is choreoathetosis, that is movement disorder, deafness, dystonia, that bad tone of the muscle. Leave it. Extrapyramidal cerebral palsy, you can also see hypotonia, flabbiness, hypotone. Okay, atonic cerebral palsy, again floppy, extremely rare. All the floppy, less toned children should be screened thoroughly because they are not necessarily cerebral palsy. It is very difficult to diagnose a cerebral palsy which is hypotonic. Because hypotonia, if it comes, including SMA, there are several other diseases which are producing hypotonia. You have to rule out each and everything. That's a hectic process that cannot be completed at this webinar. Associated problems in cerebral palsy, strabismus, there will be skin, cataract. There are several associated problems will be there. Leave it. There will be borderline IQ in many of the cerebral palsy cases, but if it is diplegia, only 2 legs are affected. Most of the cases, they will not have any issue with IQ. There is no definitive test for the cerebral palsy. You go and take an MRI so that I can diagnose the cerebral palsy. That is wrong. That doctor don't know what is cerebral palsy. Okay, it is purely clinical in nature. Only by taking history and from the clinical features you have to diagnose the case as cerebral palsy. You should differentiate the cerebral palsy from some other neurodegenerative disorders, that you leave it. Let us go to the plan of management. If you are an ideal Ayurveda doctor, no doubt you should have these type of supports to cerebral palsy children. Nowadays, we are giving, I will tell you in the last slides, we are giving support to the young Ayurveda doctors to start the children clinic, developmental disorder clinic. We are calling it as Aditi, Ayurveda Therapeutic Integration of Developmental Habilitative Intervention. That is the full form of Aditi. Simple investments, maximum 12 lakh rupees, and there will not be any huge gains, but on an average 80 to 90,000 rupees per month within 2 months. That will be break even, or we will make you break even. And we are giving, I have one group of NGOs and some other groups. They are supporting me to give, at present there are 4 Adidis are present, and 4 Adidi in Kerala are running. 4 are right now in the construction. The recent next one will be in Ernakulam district in Kumpalam, Dr. Arya. We are giving only to the doctors. Only 5 diseases will be managed in the Adidi: cerebral palsy, autism, learning disability, MR, and ADHD. One Adidi will hold only 35 children. We are not allowing to increase the number of children to a given Adidi. We will not allow. All the contract will be signed before starting Adidi. I am the person, I am giving all the support, all the technical support, everything, training, trained staff, and trained physiotherapist, and trained Ayurveda therapist, and everyone we will give you. And for first 6 months, I will give even online consultation free of cost. You start, because it should spread. It should spread. Because Ayurveda having that much tremendous effect when it is combined with physiotherapy, occupational therapy, educational therapy, orthopedic support, and everything. Only 9 staff will be there in one Aditi, including that Ayurveda doctor. We are giving Aditi only to Ayurveda doctors and to the special moms, and to the therapists. Therapist means speech therapy, occupational therapy. We are giving special training to them. They are giving special training to them. Then only they will be eligible to start this Aditi. Okay, what I'm telling, if you want to start a clinic on developmental disorder or cerebral palsy, no doubt you should have some tie-up with these facilities. Physiotherapy, occupational therapy, and there is no need of any huge investment or anything like that. Now, these are the different therapies which are present nowadays, like massage, exercise therapy, hydrotherapy, grasping and releasing, speech therapy, aids and stretching exercises, and everything. Leave it. These are the different surgeries. Actually speaking, this type of big team are needed to manage cerebral palsy. But proper antenatal care, proper perinatal care, proper treatment of asphyxia, proper care of low birth weight babies, early treatment of hyperbilirubinemia, all these can prevent the incidence of cerebral palsy. We are giving this preconceptual care to all such children and parents. In Ayurveda, most of them are sahaja. Leave it. What is happening? Whatever may be the nidana, it may be manufacturer defect, or it may be a rearing defect, or it may be a feeding defect, or it may be a defect of fertilizer, whatever it may be. What is happening at the time of birth or just before birth? There are some nidanas which give some functional obstruction to the dhatu flow into the brain. That functional obstruction caused dhatu kshaya in this costa, in this cranial cavity. That dhatu kshaya causes vadavriddhi in this costa. Costa means Kush's thumb. Kush's thumb, something which is encircled. That is the meaning of costa. At that vadavriddhi time, the child will be in ICU, no doubt, because there will be seizure or there will be some hypoxic symptoms and everything. And that vata spread all over the body. The baby is in universal flexion, so whole legs will be flexed, and on that flexed area, the vata will get stance samsraya on sira, meda, snayu, and mamsa. These are sira, meda, snayu, mamsa are except sira, all others are kapha thrust areas.
Medasah snehamadaya sirasnayuttomad. Medas is more kabha, mamsa is more kabhaja, snayu is coming from medas, and in this kabha side, vata came and it made its pansamsraya, it produced either hypertonicity or hypotonicity or movement disorder. If it is hypertonicity, that is called as spasticity, rigidity, or contraction. That is more tight. More tightness means more Vadika type. More loose means more Kabaja type. There is movement disorder means more Vadika type. So tightness, looseness, movement disorder. And hypertonicity in Ayurveda, stabdatvam, kubjatvam, kunitvam, these are the terminologies which are given in Ayurveda. Stabdatvam, anganam vakratvam kunitvam, stabdada, hirakriyangada, motor activity will be reduced. Anganam vakratvam, deformity kunitvam, kubjatvam. Probably you may be remembering Sirasnayugatavada. Talsidam snavastitaha gridrasi ayama kubjada. Snayu is the chief culprit. Sunita is remembering from the olden days. Yes, what is that? Yes. Talsidam snavastitaha gridrasi ayama anganam vakratvam kubjada, scoliosis, or any such deformities are caused by vata in snayu. So what is snayu? Snayu is nothing but not the tendon. I will give you that narration later. And there are some other area in which kabham is giving styrium chiragaritam to make it more chronic. So vata is situated in sira, snayu, medas, mamsa, sometimes in asti, which is producing spasticity. Hypotonia or jadatvam is happening due to sankam, sadam, chiragaritam of kapha. And this jadatvam is always, or floppiness is always more kapha in nature. Spasticity is more vata in nature, even though both are kaphavadiga. More kapha is present in hypotonia, more vata is present in spasticity. In Akshapagam, the Vigrita Vada Lakshana, that is Pandanam, is happening. You see, when I usually coin the term stabdatva, hypertonicity, it is always a neurological lesion. We know hypertonia is always happening due to motor neurological lesion. And snayu, these are the references of snayu in our samhitas. Snayavaha shanagaram, thread-like structure. The maximum number of structures in Sharira Sankhya Vyagaranam 900 is attributed for snayu. Apatamastagam, from head to toe it is distributed. Nahyastini navapesyo nasira nacha santayaha vyabadita yadahanyus tada snayur charidinam. It means that snayu is the structure which is causing maximum harmful effects. Then convulsive disorders are happening whenever vata is situated in snayu. Then kubjatvam, tetanic postures, spasticity, everything is produced by snayu. What is that? Is thread-like structure, nothing but nerve. So the snayu is neurological lesion. Main points to remember here, problems are at sthayi dhatu, because it is a product of madhyama roga marga. Sthayi dhatu means you cannot decrease or increase the dhatu by taking or chicken biryani or by taking any grape juice or anything like that. If you have the pandu, anemia, take 5 days of grape juice, it will be replenished. That is asthai dhadus. Asthai dhadus are present in Bahiroga Marga. But in Madhyama Roga Marga, everything is solid structure. My biceps, my humerus, my femur, and my ligaments, tendons, Madhyamo, Murda Hrudaya Bastyadini, Marmanyasti Sandayaha, Tatroba Nibaddascha, Sirasnayu, Kantaradayaha. Everything is solid structures. They are Sthai dhadus, which cannot be manipulated by simply by taking some Dasamulatrayan Kashaya or Maharasati Kashaya or Dhanandra Kashaya. It will be very difficult. That is the reason why, because all the Madhyama Roga Marga diseases are in need of Udichil, Pidichil, Dara and everything. Because you cannot reach your drugs up to level of Madhyama Roga Marga. Of course, if you are taking 60 ml of alcohol, you may have loosening of your Madhyama Roga Marga balance. He will dangle. Okay. Otherwise, if you have the poisonous envenomation, of course, there will be Madhyama Roga Marga damage. Otherwise, you need to heat from the policeman, or there should be an accident to get affected to Madhyama Roga Marga. Similar is the condition. Pachavada, Graha, Apatanaga, all these diseases are originating from the Madhyama Roga Marga, is in need of vigorous procedure-based therapies of Ayurveda like massages, Udvartanam, Abhyangam, Vasti, and everything. So Panchakarma is needed. Rasayana must be included. Long-term treatment is needed. Management of symptoms are relevant. Because everything is in Sthai Dhatu. Main points to remember. These are Kaphavadika problems. Maximum attention to Vada in case of spasticity. Maximum attention to Kapha in case of hypotonia. Maximum attention to Vada in terms of movement disorder. And there is a correction. Nowadays, I have changed my slides nowadays. I am dealing with, right now I am showing you one of my old slides because my new slides are in my new computer that I could not retrieve right now. In that, I classified the movement disorder into two. Number one is Kaphavadikam, second one is Kevalavadikam. Why? Because there are several movement disorders like Akshabaga, which are getting good improvement with Udvartana. What does it mean? Udvartana is Kavaharam, still movement disorder is getting good results. It means that it is also Kaphavadikam. So there are several diseases of movement disorder which are Kaphavadika in nature. These are the different supports which we need. And these are the principles what we are giving. Rukshanam, of course, because it is Kaphavadika problem, I have to remove the Kapha. Snehanam, I have to remove the Vada also. Swedanam, Swedanam is hot in nature, which is good for both Kapha and Vada. Shodhanam, it's a beautiful concept, but you won't get good results. But conceptually, you should do Shodhanam because Shodhanam will not give you much results in cerebral palsy. Brahmanam, I have to give Vata Shamanam. Rasayanam, for prolonged usage of medicines. Rasayanas are best to manipulate the diseases coming out of Madhyama Roga Marga. Medhyam, most of the cases are associated with intellectual impairment, so Medhyam is needed. And symptomatic management. Symptomatic management is very, 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 very important. I will give you one example. Many people, because people don't know what is Ayurveda, that is why we are so saved. Because many a times, whenever the cerebral palsy children are getting admitted in the hospitals of Ayurveda physician, they will initially start, oh, everything is Vada. Vata is a Tantra Yantra Dara. So every movement is Vada. Movement is restricted. So we should give Vatahara, Abhyanga, Pichu, because brain is that thing, this thing, Pichu is good, and to cross the blood-brain barrier, we should give Gruda. All such superstitious beliefs are actually residing in our brain, and they will start this treatment. Immediately they will catch cough and cold. The child will suffer from immediately cold, cough, and fever. The treatment will be stopped for next 1 week. So the parents told that he is used to get the cough and cold and everything. That is the reason why, because he is unlucky because he didn't get that proper treatment of that great Dr. Sunita or Aishwarya. And so anyway, leave it. We will try next time. They will go and come again. Again, you will start the Pichu, Kruta, Binga, and everything. Again, the child will catch cough and cold. See, the problem is that you are doing wrong treatment. You are doing wrong treatment. Kapha, Shwasa, Kasa, Pradishaya, everything is the problem of Kapha, Vrta, Prana, and Udana. Kapha, Vrta, Prana, and Udana. What are the functions of Prana and Udana? Tatra Prano, Murdanyavasthidaha, Kandorasara, Buddhi, Indriya, Hridaya, Mano, Damani, Dharana, Stivana, Chavadu, Udgara, Praswasa, Anna, Praveshadi, Kriya. All these are hampering in cerebral palsy. Unable to swallow. Not properly taking the food. Prasarana Agunchana Pravrti of Vyanavayu is also getting hampered. Udano, Rasyavasidaha, Kandanasiga, Napicharu, Vak Pravrti, not Vak Pravrti. Trying to order Belavarna Soda Mano, Bodhanatikriti, everything is hampered. So the Swasa Kasa and cerebral palsy is one and same pathology. In that case, you are again adding Kapha dosha by giving Abhyanga, Grida, blood-brain barrier, Nasya, Pichu, and everything. Immediately, the child will catch cough and cold. That is iatrogenic. That is physician-induced. Fortunately, the people don't know what is Ayurveda. Okay, so mind it. These are the very dangerous situation what we are creating nowadays. And what are the Rushana procedure what we are doing? Udvartana, Dhanyamla Parishega, or Udkarshana. That is the Udvartana and Udkarshana difference. Udvartana, there should be a fluid media. Udkarshana, there will not be any fluid media. Dhanyamla Potali, Katikiri. And in Snehana, you can do Snehana, Binga, Matravasti, Pidichil, Pichu, Shiravasti, and everything you can do at right time. No doubt. I will give you that the time. Swedanam. Any Swedana can give good results if it is not Snigdha initially. Yogavasti, you can do Virajanam, you can do Nasa, you can do Vamanam, it is impossible. Rasayanam, these are the Rasayanam what we are using. Rasayana drugs. See, the Guluji, Nagabala, Brahmi, Sangabushpi are the Rasayana drugs what we are using. I will give you certain other additional points because those slides are not here, but I will give you. You can have some Brahmana, but you should be very cautious because child is very prone to develop respiratory symptoms in Brahmanas. Now, I will give you what is my procedure. Those slides are not here. I will give you one thing. See, my present procedure is in hospital management, we admit, not in Aditi. In Aditi, we are giving 10 days of treatment once in every 6 months. Once in every 60 days. In most of the cerebral palsy, 10 days of treatment, only 10 days. Ayurveda. Rest of the days, in Aditi, our cerebral palsy protocol is the parent has to stay surrounding the Aditi
In Aditi, there is no inpatient because that is not affordable to the parents. You have to find out nearby house which should not be more than 5,000 rupees per month rent. Of course, if parents are asking, okay, I need 10,000, it's okay, you can give. Compulsorily, you should seek the houses which are having monthly rent of 5,000 per month. And they have to come to the Aditi for Ayurveda, for physiotherapy, for occupational therapy, for speech therapy and behavior therapy, and they will go after all this therapy. This is the procedure of Aditi. This should be continued minimum of 6 months, maximum up to their interest. That is the protocol. In such situation, we are giving 10 days of Ayurveda treatment once in every 60 days or once in every 40 days. That is according to the condition. See, floppiness is Kapavadika problem. Spasticity is Kapavadika problem. Movement disorder is also Kapavadika problem. For Kapha dosha, you need Luchana. For Vata dosha, you need Snigdha. For Kapavadika, what you will do? Aishwarya. It's a Kapavadika condition. So what you will do? For Kapha dosha, you should do Rushanam. For Vata dosha, you should do Snehanam. For Kapavadika, what you will do? A wild guess. Wild guess. Wild guess. Sunita madam. Tell me. Rushana?
So Ushna is a property that is actually
yes, good for both.
Yeah.
So everything should be in Ushna in nature. Okay. What should be the other guna, Rusha or Snigdha? Which should be given?
Ruksha first and then Snigdha.
That is the best option. Alternate Rusha and Snigdha. Rucha plus Ushna, Snigdha plus Ushna. Rucha plus Ushna, Snigdha plus Ushna. Alternate Snigdha Rucha therapy should be given in Aditi concepts 10 days in every 40 or 60 days. In hospital concepts, if they are coming only for the Ayurveda therapy, okay, you can have 31 days of treatment once in every 6 months. 31 days, 1 month of treatment once in every 6 months. Why these dates? Why these days? That I will tell you. See, the basic principle of brain development in cerebral palsy is neuroplasticity. Neuron is like plastic. You can melt it and you can mold it and you can make your own shape. For that, the present science and technology, which found most effective treatment to get maximal neuronal plasticity is contrast stimulus. Contrast stimulus in physiotherapy, what they are doing, hot and cold therapies. Ice packing, hot fermentation. Ice packing, hot fermentation. In Ayurveda, there are 20 types of contrast. What are they? Vimshati gunas. Snigdha, Rusha, Ushna, Shida, Sthira, Chala. Everything should be applied. Everything should be applied. Stiram, bandage. Chalam, physiotherapy. Ushnam, Swedanam. Shidam, Shida Parishegam. Snigdham, Rucham. See, such different types of contrast stimulus you should give. How can we give? I will give you my protocol. Number 1, in the morning, initially start with the Rucha. Otherwise, the child may catch the cough and cold. In the morning, 8 o'clock, there will be half an hour Udvartana. In my hospital, morning, there will be half an hour Udvartana. Okay. In 11 o'clock or 12 o'clock time, there will be a Takradara. What is that? Takradara, that is Rutana. What will be the medicine which I use? Dashamulam plus Sapnya Stabhanaganam, not Amalagi Musta. Dashamulam plus Sapnya Stabhanaganam. All those are Ushnam, Kapavadaharam, Prana, Kaphavrata Udana indicated. Dashamulam, Sapnya Stabhanaganam. So in the morning, there will be an Udvartana half an hour with the Yavagola Gulata Churnam. In the noon time, before taking meal, there will be one Takradara with the Dashamulam Sapnyastabhanaganam. And in the evening, the house surgeons will come to the KB ward to give them one Pradhamanam. Simply powder instillation, Pradhamanam. Okay. And there will be one stiram treatment, that is bandage with Vimlabana Dravyas in the spastic joints. In the evening, there will be bandage. In the night time, before going to sleep, 1 hour play in Avagaha tub. 1 hour play in Avagaha tub, which will be fortified with Dashamulam Kwadar. See, Rushana is over. Next day, so by that time, Kapha will be removed, Kapha will be pacified, and all areas will be reducing its morbid Kapha dosha, and Vada will be slightly started to aggravate. The next day, morning, there will be half an hour Abhyanga. Dhanandaran Thailam, Karpasastheti Thailam, or Kotanchukadi Thailam, Karpasastheti Thailam. Such Ushnam Kabavadaharam Thailam. In the noon time, there will be a Pichu, Shiro Pichu. By Dhanandaran Thailam, Karpasastheti Thailam. In the evening time, there will be Pradimarsanasya, 1 drop each. Dhanandaran 101, Cerebral 101. And after evening snack, there will be a Matravasti. There will be a Matravasti. Bas, Snehanam is over. Next day, again Rushanam. Next day, again Snehanam. Next day, again Rushanam. Yes, this will continue. This is the protocol which is otherwise called as cortical protocol for the management of cerebral palsy. Alternate Snehana Rushana therapies. Not a single neuron inside that brain will not stay idle. Everything will be highly alert. If you are continuing this for 21 days, 21 days are the minimum number of days which are needed for forming a permanent circuit by neuronal plasticity. Along with physiotherapy, along with speech therapy if it is needed, along with occupational therapy, such a beautiful outcome you cannot imagine anywhere in the scientific world. I have tie-up with the First Medical University in Moscow to do the researches on cerebral palsy. What they are doing, you know, the First Medical University is the biggest university of Russia, which took part in the Second World War extensively. They have a robotic environment for the management of cerebral palsy children. Instead of doing the physiotherapy by manual, the robot will come, assess the tone of the muscle. Accordingly, they will apply the force. Okay. And First Medical University is having all alternative medicine except Ayurveda. So we went over I went over there once for They invited me for a BRICS country conference. BRICS country conference: Brazil, Russia, India, China, South Korea. BRICS country conference on traditional medical system. One of my paper was there. Along with that, I intruded in this first medical university, this department, and we suggested Ayurveda, as a part of which we conducted a pilot study. they really wanted, so that if they reached into a position that they just can't believe that this is happening. That is the beauty of the combination of both Ayurveda along with other therapies. They are again going to do certain other works regarding this type of researches. Okay, leave it. So this is what is the protocol of management of cerebral palsy in cortical protocol. And of course, we are doing certain yoga vasti at the end of the Snigdharusha program. In that, why? Because, you know, everybody is believing that Vasti is for Vada. That's our alphabet knowledge, no? Vasti is for Vada. Who else is present other than these two guys? Yes, madam. We see one. Nimesh, Salim, Chandra. Yes. Vasti is for Vada, no? Nima, Salim. Unmute. Let us have an interaction. Kid know that. Yes. Vasti is for Vada, Nanima?
No, sir, not necessary. According to the medicine, we can change, and according to the condition, disease condition, we can change the medicines and do Vasti Dashamula, we can use Dashamula, Kashaya.
For which dosha?
Like Vada Kapha.
Vata Kapha.
Like
So,
Vada Kapha Grudrasi, we can use other Kashayas in Vasti.
So Vasti is primarily for which dosha?
Vasti is primarily for Vada dosha, but according to the disease condition, we can change the medicine. We can use Sneha in like Sneha.
Vasti is Shodhana therapy, no?
Yes, it is
Shodhana is Lankana, no?
Yes.
Vata is increased. Whenever the Vata is increased, how can you treat an aggravated Vata with a Lankana therapy like Vasti?
Just let me think, sir.
You are absolutely true. You are absolutely true. Are you in academy or in practice?
I have not started my practice yet. I had my baby and I am out of practice, out of academy for 2 years, sir.
Wow.
Right
Okay.
now I'm starting my practice and my academic.
Great. See, this is my basic question, that Vasti is Lankana therapy. It is indicated for Vada Vruddhi. It's a self-contrary statement, because Vada Vruddhi has to be treated by Brahmana therapy. Am I right or not?
Yes, sir.
It means that whenever the Vada Vruddhi is happening only two ways. Number one is Dhatu Kshaya, second one is Avarana. As Dr. Nima told, whenever the Pakvasegada Srodas is getting Kabhavarana. Thereby, if Vata is aggravated, to remove that Kabhavarana, you can use Niruha so that Vata will be normalized. So, basically, this Niruha is simultaneously managing Kabha and thereby Vata. After that, this Vata is managed by Snehavasti alone. This is the basic principle. If you are not treating cerebral palsy, spasticity may increase. At that time, Vata is coming from the Pakwasika. You should do some Pakwasika Vata Chikitsa. For that, please do a course of Yoga Vasti at the end of this program. At the end of this program. Okay. So these are my suggestions, and I will give you some glimpses regarding Aditi too, because I have I will give you the Aditi concept, because what my suggestion is, always, if you are in pediatric practice, to do not necessarily in pediatric practice, if you are a jobless person, or if you don't get a good practice, even with your knowledge, and after practicing 1 or 3 years of in your field, still if you are having this issue of practice better, you start with such concepts like Aditi, not necessarily Aditi, that integrated management of Ayurveda and other therapeutics in the management of different developmental disorders such as cerebral palsy. As I told you, if you have 3 Grama Panchayat near to you, in 30 kilometers, there will be 35, at least there will be 35 developmentally disordered children, and they will come to you, because these are the only option in the management of developmental disorders. And this synergistic effect will give you that much wonderful results, and that will be ever memorable by the parents. And I will give you certain areas, or I will give you certain photos regarding the Aditi, or about the Aditi. You see, you may be seeing the Pancharma theatre of Aditi. This is the Pancharma theatre of Aditi. You are seeing, no? You see, this is the sensory physiotherapy unit of Aditi, and this is the Panchakarma theatre of Aditi, and this is the sensory integration therapy unit of Aditi, and these are the different therapy rooms like yoga, speech therapy, behavior therapy, educational therapy, and sensory integration therapy. This is the chief consultation room of Ayurveda doctors. Okay, so this is the area where we should have our concentration, specifically low budget in investment and maximum output. To if you want to know more about this, you just I will give you one 9744498529. I am texting it in your message box. Just have a message, WhatsApp message in this. They will give you a Google form. Those people will, Aditi people will give you one Google form. You fill it and you will get the feedbacks, how to proceed with that. Okay, what I am telling, my service in Aditi will be totally free of cost. My service. That means up to 6 months, up to 6 months of time, I will be with you to take your hands, to give you a good rail to run. After 6 months, if you are unable, I am helpless. I am totally helpless. Okay. By this, I am winding up. Thank you very much for this wonderful opportunity to the team of this Prajna. If you understood something, that is so privileged, and I will be so happy if you understand the concept of cerebral palsy and how to manage this. If you don't understand, just forgive me, that is due to the fault of Dr. Dinesh KS. Thank you very much.
Thanks a lot, sir. It was an eye opener. The session was totally worth, and we look forward to more of such sessions in the future as well. We thank you for the obesity session which you conducted before, and we are extremely thankful for this session as well. So I think we have few questions in the chat box here. So Doctor had asked what should be added to Dashamula in Takradhara. So they're not really, I mean, there's some language issue, it seems. I think it's Sapnya Sapstapana Gana, right?
Sapnya Stapana Ganam, Charagam, Panjasat Mahagashaya.
Okay, sir. So Dr. Neetu had asked, if you could repeat the associated problems in CP. The question seems to be a little unclear. Maybe she has asked about the complications, if I'm not wrong. So, sir, if you could add on that.
The comorbidities of cerebral palsy they are asking.
Yeah,
no?
maybe, yeah.
See, there are several comorbidities, like the initial comorbidity from the Rasa Dhatu itself, it is seen that recurrent respiratory tract infection, recurrent fever. From every dhatu, from Rakta Dhatu, you can see several allergic reactions and skin reactions and this eye vision problems and everything. Then Mamsa Dhatu, from you can see that this wasting and other issues of this thyroid issues and everything. So every dhatu is having chance of getting affected due to the samprapti of cerebral palsy. So everything has to be managed either by Ayurveda or by other streams, because ultimately we should give a comprehensive management. Then only people will be happy.
Okay, so there's another question from a doctor asking the Rasaushati preparations that can be added in CP cases.
Of course, it can be added, but I am very poor in usage of in using this Rasaushati, except some Shwasanandam Guliga or some Lakshmi Vilasarasam for fever or something like that. I'm not using it.
All right, sir. And then doctor had asked for the some Shamana medicines to be given post therapy.
Good question. That I have forgot to mention that. See, Shamana Ushadas, the principle should be Ushnam, Kapavadaharam. It should reach Prana and Udana, then Dhyana Vayu. Okay? Prasarana Gujjana Pravrti is getting hampered now. The most usual prescription from my side to satisfy these principles are Ashtavargan Kashaya and Dashmulagadtrayan Kwada. These are the usual Kwadas. At the same time, you should give Vatanilomana and Divrapacharanta Kosta. So I always prescribe along with that Rajanyadi and Avibhati combination. Always look into the Pakwasigata Vada in cerebral palsy. If it is there, you should do the management of Pakwasigata Vada first. Pakwasigata Vada will be manifested as Pakwasigata Gurdaha, Shulana, Andra Gujanam, Malarodasma, Varma, Arsa, Turkaprashta Kadigraham, Karotya, Daraga Yeshu, Chatam Stan Krutrano Badravan. The first sign will be constipation. If it is there, you treat that constipation with Pakwasigata Vada Chikitsa like Gandharavastadi or Sirividluadi, and after that you can shift it to this Ashtavarga, Desimuragadtraya like Vadas. So these are the usual Shamana Ushadas what I am using. And then according to different conditions, like for example, if the movement disorder is there, movement disorder is almost similar to Akshapaka and Apatantraga, Apatanaga. These are the different movement disorders which are giving in our science. You see the samprapti of such movement disorder. Adha pradihado vayur vrajanurdvam hrid asrayaha nadi pravisya hridayam shiras sangam chapitayan ashipel palido gatram. So adha pradihata vayu, the obstructed vayu in downside, which is the vayu which is having most probability to get obstructed, apanavata. So you should always give apanavata nilomana in case of movement disorder like Gandharvastadi, Sukumara Gashayam, Gurdam, then our Saptasara Gashayam. These are the different Kashayas which I am using for Vata and Lomana in such cases of Akshapaka Vadavya.
All right, sir. And then we have a question from a doctor asking, is it obvious for the cerebral palsy to present symptoms like plesias? Like minor symptoms like eyelid drooping can also be presented, right? So
eyelid drooping cannot be presented in cerebral palsy. If a baby with a developmental disorder is having eyelid drooping, you should be very cautious. That case may not be an eyelid, a cerebral palsy case. That will be usually something other than that. For example, congenital myasthenia gravis. That will be presented as, or SMA, spinal muscular atrophy. So these are the different conditions where eyelid drooping are happening. Okay. Rasatailam Abhyangam. Somebody gave Dr. P. Sivarama Krishna. True, absolutely true. Rasatailam, which I am using, if it is more Vadiga in nature, because Rasatailam is more Brahmana type of medicine and that can be used. But if it is Kaphavadiga condition, better you go for Ushnam Kaphavadaharam, like a Karpa Sastyadi or these cotton chukkadi type oils. Rasatailam is a beautiful one, which can also be given as Vasti and Pana, which is available in Kerala market also. Reference from Arogya Krishna Kalpadrum. Vatasini. Vatasini is a good substitute for this Karpa Sastyadi.
So a few doctors have also asked about Aditi programs in detail. So is it better to give that number so that they can directly contact them and
yeah, that is best. You just contact with that number 97444 98529. I texted in this that. So you just have a WhatsApp in that. They will give you one Google form and the PR of Aditi will contact you and they will give you, there are several norms and conditions for the installation of the programs. You have to satisfy that because these Aditi people are asking for some royalty amount also from this also because they need to give continuous support of all other manpower management, human resource management, operation management and everything because they have such salaried people. I don't know the exact whole details of Aditi that they will give you. But my service will be free of cost.
All right, sir. So I think we have covered almost all the questions. If I've missed out on any, please, doctors, feel free to ask your doubts here. So I think we are done.
Yeah.
Thanks again for the session. We definitely look forward to more of such amazing sessions from you, sir. And thank you for the insight on Aditi as well. I mean, that is something that every practitioner, every budding practitioner can actually try on and, get help from. So I hope it benefits. And we thank all the participants also for following all the online etiquettes that was demanded. And it was all glitch free. And I'm totally thankful for that. Thank you so much.
Thank you. Good night.
Good night, sir.